If you are somebody who continuously washes their hands or trying to put things in a symmetry or little obsessed with counting of items, then there is a strong chance you are suffering from OCD. In this particular episode, we are going to talk about how to deal with OCD and how to deal with people who are suffering from OCD. So coming up. Hey guys, welcome back. Sometimes in our relationships, we have to deal with situations where we have a partner or family or friends who have OCD. Today's video is a special request from many of my seafarer friends who are out at sea and they are dealing with OCD of their spouses who are back home. OCDs are learned behaviors which are excessively repeated. This can happen due to a belief which is behind it or due to anxiety which it actually relieves. There are 4 types of OCD. Number 1 is a type called contamination, where somebody believes that something is never too clean. They want to keep cleaning the doorknobs, they want to keep washing their utensils because they feel they have not achieved the level of cleanliness, or that which was affecting it has not yet been achieved. The another type is an accidental OCD. It can also be as serious as a rape, because a woman who has possibly gone through something like that in her life, she will feel very OCD behavior towards men. She will not want to even touch such people because of the trauma that she's gone through. I went through a situation where on the ship we had somebody who almost fell off the gangway and was kind of hurt. That trauma has made me a very big OCD towards the gangway setting on the ship. If my people are not careful about the gangway, I get OCD. The third type of OCD is about symmetry or counting, because such a person will always want to keep things aligned in one place. Maybe the curtains have to be absolutely in line, maybe the pen has to be perfect, or the desk has to be kept exactly as they like it. Otherwise they get that anxiety, they get that hook from inside and they don't know what's bothering them, but they want it corrected. Fourth type of OCD is a genetic, as the medical science calls it, but as hypnotherapists we believe it's past life related. So if you are somebody who wants to find out anything about past life, then we can help you with that. And sometimes some situation or a trauma which has happened in a previous life affects your present life. So you will not know why do you have a fear of water, why do you have a fear of heights, but these are unexplained because these are coming from some past memories of the previous life. Fifth type of OCD is maybe the type that we cannot put in any of these 4 categories. So it could be related to any kind of beliefs. So if you are somebody who's not been covered in these 4 types of OCD, then do comment to me and let me know what it is, or write to me. Even my email ID is below. How to cure OCD? Or let's say, do you want to cure OCD? Do you even want to call it a disease? The meaning of disease is dis-ease. The person who is going through OCD, is he in dis-ease of his body or not? If you are fine doing it, then there's nobody who should interfere with it or who should have a problem with it. As long as you are not doing something unlawful or you're not bothering somebody physically or mentally. So if you are somebody who believes that somebody has OCD and they need to be corrected, somewhere maybe you need to be worked upon, because it's very important to work on people who believe others have a problem. And continue to watch to know how you're going to deal with it through this video. What level of the behavioral aspect are you in? This is going to be very relative, because how much is excessive alcohol? Nobody knows. It's very relative. Is 1 peg excessive? Is 2 pegs excessive? Or 3? We don't know, because it's very relative to the one who's observing you and who believes you are having excessive alcohol. So OCD is similar. If you are somebody who likes to be very clean, then you like to take bath twice a day, it's recommended. If you like to take bath 3 times a day, why not? If you like to take bath 5 times a day, Is it OCD? But if you are okay taking bath 5 times a day, who the hell am I to tell you what to do? There are two matters that we need to deal with in OCD. Number one is how to treat your own OCD, and number two is for family members who are dealing with somebody who's having OCD. Even in hypnotherapy, we have two ways to solve the OCD problem. One is by installing commands into your mind, into your brains, and creating triggers for you to be away from the OCD. And another way is to go to the core of where this OCD has started and to solve the core, because sometimes OCD can always be like an onion peel. There is a lot of peels to it, and we find that the core of the matter lies somewhere else. And we actually go and cut the root of the tree, and that's when the rest of the tree dries up. How the family needs to deal with OCD at home, I'm going to give you 4 tips. Number one is never highlight the negative. Always highlight the positive. If the person is washing their hands too often, don't go and tell them stop washing your hands, because you're highlighting the negative. Instead, when they are not washing their hands, let them know that it's so nice that you're actually relaxed and sitting here and your hands are still so clean. The second tip is we give affirmations for you to deal with the situations. These affirmations, when read out to the person or spoken to together as a family, these will help you heal out of that. Tip number 3 is never be against the person. You may have an issue with the person's problem, but if it starts becoming directed to the person, that person will never listen to you, because he will always be against you. You must always think about the FOR, the frame of reference of what that person comes from. That's when the person will get trust in you and then start listening to what you're saying. And this can be over a period of time that you slowly bring in the changes and not out of any manipulative behavior. You do it purely because you love them and you want to heal them and you believe that this will help them. And the 4th tip is never challenge them, because the person's conscious mind is already set. The behavior is coming from the conscious mind because it's the logic mind. The logic is telling the person, wash your hands or take care of the gangway, people fall. If the logic mind is against you when you challenge it, it will never let the suggestion go into the subconscious, and you will never be able to access that person. In fact, that person will actually go totally against you. But our behavior towards people who are OCD is kind of like a herd mentality. Just because that person does not follow the normal routine of what society says, we start terming them something else. If you are somebody who's not harming anybody, and if you're not somebody harming yourself or being an annoyance to anybody else, then it's okay to be not part of the herd. We all don't need people to just follow what we want them to do. Allow them that space to also be what they are. Today, medical science also tells us that blood pressure is 120/80, but it has been proved that it is only an average that has been taken over a number of years and over a number of people. But somebody having a different pressure or their pulse rate is normally higher than 72, way higher, they are still fit. So if you liked what I shared today and you find it of value and you gained from it, please don't forget to subscribe or like it and share this video. Captain Amit Bhandari signing off. Bye-bye.